patients with hormone receptor-positive breast cancers at early stage are at risk for recurrence even 5, 10, and 15 years later. So ongoing hormonal therapy is something that has been investigated, but we have very little data beyond 5 years of treatment. We know in the case of tamoxifen that 5 years is certainly better than 1 or 2 years, but we know that at 5 years patients are still at risk for recurrence. Now with aromatase inhibitors, we do know that extended therapy after 5 years of tamoxifen is effective for postmenopausal women. But we don't have any information about longer durations of tamoxifen. Researchers from the ATLAS study, which is a study of shorter versus longer tamoxifen, presented their results earlier at the meeting. This was a study where physicians who at the time they felt their patient had had what would be considered the standard amount of tamoxifen, which for the most part was 5 years, but the protocol didn't say it had to be 5 years, at that point were able to randomize their patients to either stop at that point or continue for another 5 years. This study reported its results and showed that in fact there is a small but statistically significant improvement, about a 3 to 4% reduction in the risk of recurrence, and also a difference in the mortality rate. And so this is probably important mostly for premenopausal women who after 5 years of tamoxifen are still premenopausal, so they're not candidates for aromatase inhibitors. And for these patients, this is truly practice changing. I think that if a patient has been tolerating tamoxifen well, especially if they have higher risk disease, positive nodes, larger tumor, that they should be offered 5 more years of tamoxifen. One concern is that there may be a higher risk of endometrial cancer, and there is in fact a higher risk. It's about 1% after 5 years and a little short of 2% after 10 years. But the death rate from uterine cancer is only 0.2% at 5 years and then 0.4%. So it certainly is outweighed by the benefit. This is something that I think is ready for adoption into practice right away, and there are not too many things that get presented at the meeting that change practice, and this is one of them. There are other trials that are looking at longer durations of aromatase inhibitors, and those will be out in the next few years as well.